And hospitals want to make sure that they have enough ventilators if COVID-19 cases spike this fall. But as Amanda Brandeis learned, these complex machines also require more trained staff. So providers are now turning to lifelike robots and virtual training to prepare.
When demand for ventilators goes up, having enough of them is only one part of the life-saving equation.
There's only a finite group of people that are skilled and trained and authorized to use those ventilators.
The machines help patients breathe, pumping oxygen into their bodies.
But what's critically important is how you control that pressure.
The stakes couldn't be higher, so hospitals are now working to train more staff members to operate the devices.
Because we'd really rather have these nurses and docs practicing on a simulator before they're working on a live patient in a critical care situation.
That's where Gaumard Scientific comes into play.
Hi, I'm pediatric Hal.
5-year-old Hal talks, breathes, and moves. He's a robot capable of simulating not just medical emergencies, but also emotions.
He can actually be plugged into a real ventilator, and that ventilator will take control of his breathing functions.
Companies like Gaumard are seeing a spike in demand for training. Without being able to train in person, Zoom has become the norm.
It's the closest thing to a real-life scenario that you can get.
Located just outside of Philadelphia, Lincoln Healthcare had already developed a program to teach their at-home nurses how to operate ventilators.
We can change his breath rate, and we can make him mimic what a true COVID patient is going to look like.
We really wanted to make sure that our nurses were armored with the best training, the best emergency preparedness.
They've now opened training to all medical professionals in Philly and surrounding cities.
We actually saw some nurses that weren't even planning to work in a hospital that signed up for the training.
So right now he's turning a little blue and he's coughing. So
those hesitant to operate ventilators are finishing the training feeling empowered, knowing they're now part of the solution to this complex COVID-19 equation. In San Diego, I'm Amanda Brandeis reporting.